Vanakkam, good morning. In this video, we are going to discuss about the neuromuscular blockers. This is the important short notes in the nerve and muscle physiology. Many times, neuromuscular blocker asks us the 5-mark question in the university examination. Botulinum toxin is the one of the neuromuscular blocker. It is affect the presynaptic membrane of the neuromuscular junction. So it is derived from the bacteria. The botulinum toxin is derived from the bacteria Clostridium botulinum. Clostridium botulinum. It inhibits the synthesis and release of acetylcholine from the presynaptic membrane of the neuromuscular junction. Main feature of the botulinum toxin is the paralysis the skeletal muscle. Paralysis the skeletal muscle. The botulinum toxin use in the cosmetic purpose treatment of the Botox treatment, mainly used for the relieving the skin wrinkles. The highly diluted botulinum toxin is used for the relieves the wrinkle in the aged people for the cosmetic purposes. It is also used in the achalasia cardia. Achalasia cardia is the difficulty to swallowing due to the nerve damage in the esophagus. You will read in the GET, gastrointestinal tract physiology. So that condition rarely use the botulinum toxin for relieve the contraction of the lower esophageal sphincter. The strabismus is the abnormal contraction of the extraocular muscles. So that is make the difficult to focus the both eyes are in the same direction at the same time. Strabismus. That condition also rarely uses the botulinum toxin. And cervical dystonia. This is the muscular disorder. It will produce the severe neck pain. It tilts the head one side. That condition also use the botulinum toxin. And it's also used as a pyoderasm, as a aerosol particle, or it contaminated with the food. It is act as the pyoderasm substance. So botulinum toxin is a presynaptic block. It inhibit or release the acetylcholine from the presynaptic membrane. Hemicholinum, also the presynaptic inhibition. It inhibits the neuromuscular junction by the inhibit the presynaptic membrane. It inhibits the choline uptake by the presynaptic terminal, resulting in the depletion of the acetylcholine. So action potential cannot formed due to the decreased release of the acetylcholine. So acetylcholine cannot bind with the acetylcholine receptor. It will not produce the end plate potential. Curare is the mainly affect the postsynaptic membrane of the neuromuscular junction. It is competitive blocker of the postsynaptic membrane, and curare is the active principle of the T-tubocurarine used as the muscle relaxant. The arrowhead poison. Curare is act as the arrowhead poison in South America for the hunting purposes. It paralyzes the skeletal muscle and respiratory muscle. Calamine also affects the postsynaptic membrane of the neuromuscular junction. It is also act as the competitive inhibitor for the neuromuscular junction acetylcholine receptor. It is routinely given before the surgery to relax the skeletal muscle. It reduces the dose of the general anesthesia. It is also used for the reduce the bleeding and other complications after the surgery. It relaxes the skeletal muscle. It is also useful for the respiratory muscle relaxation, and the patient is supported with the artificial ventilation. Succinylcholine, carbamylcholine routinely used as a skeletal muscle relaxant in the general anesthetic purposes. These are the depolarizing blockers. Succinylcholine, carbamylcholine is having the biological activity of the acetylcholine, but they are not hydrolyzed by the acetylcholine esterase enzyme. So the succinylcholine carbamylcholine action is prolonged for the long time. Okay, so it bind with the acetylcholine receptor. It produces the depolarization. It opening the voltage gated channel in the inactivate state and prevent the formation of the axon potential. And neostigmine, physostigmine, both are the reversible acetylcholine esterase inhibitor. These are compete with the acetylcholine to bind to acetylcholine esterase. So it prevents the hydrolysis of the acetylcholine by acetylcholine esterase. So acetylcholine is bind with the acetylcholine receptors. It is act as the depolarizing blockers. The neostigmine, physostigmine mainly used for the myasthenia gravis. That conditions antibody formed against the acetylcholine receptors. So acetylcholine receptors are very less. More acetylcholine is destroyed by the acetylcholine esterase. So that condition, the new physostigmine, neostigmine used for the myasthenia gravis. Organophosphorus compound, irreversible acetylcholine esterase inhibitors. Pesticides like parathion, malathion, baygon spray, nerve gases used in the wars like isopropyl fluorophosphate and sarin. These are bind with the acetylcholine esterase inhibitors irreversibly. So acetylcholine is bind with the acetylcholine receptors. It produces the depolarization. It prevents the further production of the further action potential. So it produces the skeletal muscle paralysis. So the organophosphorus compound poison is more common in the hospital setup. So treatment antidote for the organophosphorus compound is the atropine. Routinely we give the atropine for treat the organophosphorus compound, and we have to give the respiratory support for the patient. Neuromuscular blockers. used before surgery for muscle relaxation and open the operating field. It is also reduce the movement during the electroconvulsive therapy in the psychiatric patients. These conditions routinely for the therapeutic use of the neuromuscular blockers. And some snake venoms also contains pungarotoxin, that is also act as the neuromuscular blockers, that is mainly affect the postsynaptic membrane. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.